Every year, millions of people watch the Oscars red carpet and they see glamour, fashion, bright lights. As a plastic surgeon, I watch it and I see wonky eyebrows, misplaced filler, and telltale signs of plastic surgery. What we've got here is a failure to communicate, because most people are watching the red carpet completely wrong. Today I'm gonna fix that. By the end of this video, you're gonna watch Hollywood's biggest night through the eyes of a plastic surgeon. And that might make your red carpet watch party a lot more interesting. I'm Dr. Kian Eftekhari, oculofacial plastic surgeon, eyelid specialist, and apparently your new Oscars co-host. My entire practice is eyelid and facial surgery, so I do this every single day. So the patterns I'm about to show you aren't speculation. They're things I've recognized from thousands of cases sitting right across from me in my exam chair. Here's the thing about great plastic surgery. You should never be able to spot it. The whole point, always, is that someone walks that red carpet looking refreshed, rested, a little more alive. That's it. Nobody in the audience or on TV should be speculating if he's had work done. If they're whispering that, then something went wrong. Mistakes leave fingerprints, and I'm gonna show you exactly where those fingerprints are. Stick around to the end of the video because I've got a bonus tip, something you can only catch on live footage that still photos will not show you. Sign number one, the deer in the headlights. This is the most recognizable one, even if you've never had a name for it. When someone just looks permanently startled or quizzical, we call that the deer in the headlights eyebrows. Here's what it looks like. The inner part of the eyebrow, right above the nose, is just sitting too high. Just a little bit too high compared to the outer brow. If the inner eyebrows are higher, that gives more of a startled, quizzical look that's less about Hollywood glamour and more about, Houston, we have a problem. So here's the anatomy behind it. There's a muscle in between your eyebrows called the corrugator muscle. It's responsible for furrowing, that scowl, the 11 lines. Maybe think about the face that Jack Nicholson made in A Few Good Men when he says, "You can't handle the truth."
Answers. I want the truth. You can't handle the truth.
Now here's an important tip so you remember this. If you're thinking about a forehead lift, you've got to avoid this particular part of that procedure. In a forehead lift, some surgeons will remove the corrugator muscle to eliminate those wrinkles. The idea is if there's no muscle, then no movement, so no lines. It sounds great in theory. The problem is that muscle also gently anchors the brow inward and downward. When you remove it, the inner brow loses that anchor and it kind of floats upwards. The brows splay apart, the inner corners are lifted too high and wide, and you get that startled, stuck open expression. In the inner brow, they're closer together. There's a natural taper from inner to outer that gives the face softness and warmth. The deer in the headlights brow is the surgical overcorrection of that. The inner corners get lifted too high, and the whole upper face reads more of like startled, surprised, scared, quizzical, rather than rested. And listen to me, just like nobody puts baby in the corner, nobody should be putting the inner brow higher than the outer brow. Cardinal sin in my book. When a surgeon does that, intentionally or not, it's the single most visible giveaway on the red carpet in my opinion. Spot it by looking at the space between the eyebrows. Are the inner corners lifted and separated? Also, does the eyelid beneath it look a little too hollow in the inner brow area? That's your first tell. All right, now, sign number two. And this one has gotten a lot of attention lately, and it goes by a name that's almost too accurate, the pillow face. Specifically, too much filler layered on top of itself over years and years. Here's how it happens. In your 30s, a little bit of well-placed filler in the cheeks can look really good. You're losing some volume, you're not sagging yet, and so restoring a touch of that fullness looks completely natural. And honestly, at that stage, you look at the results and you think, I'll have what she's having.
Oh. I'll have what she's having.
It looks great. So the next year you come back and you come back again, but then the years keep going. The face underneath all that filler starts to actually sag. And instead of addressing that surgically, you just put more filler on top of it. More in the cheeks because your injector said that it would lift them, which, trust me, filler does not lift the cheeks. That is an optical illusion that they're trying to create. And so the face slowly, visit by visit, year by year, starts to look bigger, rounder, heavier. The cheeks look like they're storing something for winter. Filler can't replicate the way your face moves the way that nature intended. It just adds volume on top of a problem that volume actually can't fix. So look out for this on the red carpet. Are those cheeks just a little too shiny? A little too exaggerated? Do the person's eyes look like they're stuck behind a window ledge of a cheek? Watch for faces that look almost geometrically round. Cheeks with a fullness that just feels unnatural for that person's age. And maybe that person smiles, but the surrounding tissue isn't quite moving with them. That's your second tell. Sign number 3 is probably the most subtle of the 3, but it's the one that surgeons clock immediately. And once you see it, you can't unsee it. Stick with me to understand this because you'll see it all around if you look for it. It's called the A-frame deformity, and it lives right here in the inner corner of the upper eyelid. So most people have a slight natural fullness on the outer part of the upper eyelid. That's called hooding, or the medical term is dermatochalasis. The inner part of the upper eyelid is naturally a little bit more hollow by comparison to the outer. That's totally normal. The key phrase here is little. When surgery disturbs this balance, particularly if somebody does a forehead lift, where again, if those corrugator muscles are removed, or sometimes if somebody does an overly aggressive upper eyelid lift where they remove too much skin, that inner hollow gets dramatically exaggerated. So now you've got a very sunken, very hollow inner corner right next to a relatively full outer eyelid. If you trace that shape on the upper eyelid, it looks kind of like the letter A, hence the name A-frame. It makes the eyes look hollowed, a little gaunt, almost skeletal in the wrong light. And in red carpet lighting, it just jumps right out. Even if you couldn't exactly describe what looked off before, now you know exactly what that problem is and where to find it. Okay, so those are the 3 tips to watch on the red carpet if you want to watch it like a plastic surgeon. But I promised a bonus tip. This is something that everyone can see, so get out your popcorn and sit back. So this is what to look out for. When stars are being interviewed and their mouth is moving or they're smiling, don't look at their mouth. Look at their forehead, because the forehead never lies. If someone has had a little too much Botox or corrugator muscle removal, you'll often see the lower face doing all the work, animated, expressive, totally normal, while the forehead just sits there totally frozen, like it kind of opted out of the conversation. Now, there's nothing wrong with Botox, and lots of people get it, but if you're trying to spot an easy sign of a cosmetic treatment, remember, the forehead never lies. So there's your red carpet surgeon's checklist: the deer in the headlights brows, pillow face from too much filler, and the A-frame. And don't forget to watch the forehead on live footage, because good surgery, the kind that's truly invisible, should have won you over the moment that someone steps on the red carpet, like you had me at hello. That's the standard. Anything less than that, and now you know exactly why. If you want more of this, hit subscribe. We go pretty deep on eyelid and facial surgery on this channel. Drop your questions in the comments. I actually read them. Enjoy the Oscars and try not to stare too much.